Myself, Dr. Surendra Kumar, Associate Professor in the Department of Orthodontics, Dental Institute, Mumbai. Today, the topic of discussion will be impression materials. This is a very important topic, and in coming to history, in the 18th and 19th century, these wax were introduced, followed by wax with POP, that is plaster of Paris. And after that, the hydrochlorides were introduced in 1925. And followed by 1930, the zinc oxide ethanol came into being. In 1936 to 1940, alginate was introduced by Dr. S. William Wildings. Whereas in 1950, elastomers were introduced, and then polyether, then latest addition and light cure elastomers were there. And then the new devices came in the 1990s to 2000. And then research continues after that till now. Newer materials are being formed. Going to introduction. In dentistry, impression material is a dental material whose function is to accurately record the dimensions of the oral tissues and their spatial relationships. Each type of impression material possesses different type of characteristics and for their purpose of need and their use. An impression is a negative likeness or a copy in reverse of the surface of an object or an imprint of the teeth and adjacent structures for use in dentistry. Whereas an impression material is any substance or a combination of substances used to make an impression or negative reproduction. As you can see over here, this is an impression over on the right side of an arch, partially denture arch. Coming to classification, impression materials can be classified according to elastic and non-elastic types. Under the non-elastic are zinc oxide ethanol paste and impression compound. Under the elastic type, there are hydrochlorides and rubbers. There are two types of hydrochlorides, agar and eminent, and there are mainly three types of rubbers, which are polysulfide, polyether, and silicon. Silicons can be divided into adhesion and condensation silicon. They can also be classified according to setting reaction as irreversible. That means it is a chemical reaction. It sets by chemical reaction. Under these are the plaster of Paris, zinc oxide impression paste, the alginate, and the non-aqueous elastomers. Whereas the reversible, that is, they set by temperature change. So they can be thermoplastic materials. That means you give heat and it becomes softened. Upon cooling, it will become hard or rigid. So the examples are impression compound, the waxes, whereas non-thermoplastic materials are agar. According to elasticity, they are elastic impression materials like alginate, agar, and again elastomers, and non-elastic impression materials like impression compound, impression plaster, zinc oxide ethanol, and others. According to the use in dentistry, they can be used for dentulous mouth. That means those teeth which have teeth, those mouth which have teeth, and alginate, agar, and non-aqueous elastomer. Whereas if you want to make an impression of the edentulous mouth, where the arch does not contain any teeth, we can use impression compound, impression plasters, zinc oxide ethanol impression paste, and certain type of wax. According to viscosity, they can also be classified into mucostatic material and mucocompressive. Mucostatic means they do not compress the tissues while making an impression. For that, we can use impression plaster, zinc oxide impression paste, agar, and alginates. And they have to be in a low viscosity, basically. Now coming to mucocompressive, that is impression compound, which compresses the mucosa while making an impression. So what are the requirements of an impression material? First of all, they have to be fluid enough to be adapted to the oral tissues. They should be viscous enough so that they can stay inside a tray while we are taking the tray to the mouth. They should set into a rubbery or a rigid solid in the mouth. They should set impression. The set impression should not distort or tear when they are removed from the mouth. Adequate setting characteristics that meet the clinical requirements is necessary. Adequate strength is very important. It should possess elastic properties. Dimensionally, it should be stable, compatible with the dye or the cast materials, easy to use with minimum equipment, pleasant taste, odor, and aesthetic colors. It should not harm the skin it should be non-toxic, non-irritating, adequate shelf life, and one of the most important is that it should be economical. Now let's take one by one the impression. First of all, we are taking the impression compound. They are rigid, thermoplastic, and compressed. The composition, these ingredients contain waxes like these wax, and they are used. Their function is to soften on heating, brittle, tasteless, odorless, and easy to touch. There are other thermoplastic resins like rosin, shellac, copal resins. They are primarily responsible for transition from solid to liquid state. Fillers are also added to increase the strength and rigidity at room temperature. Plasticizers are added like stearic acid, gutta-percha to improve the plasticity and workability, to make them basically plastic and soft, and certain coloring agents. Now, there are two types according to ADS classification. Type 1 is impression compound, type 2 is spray compound. Type 1, that is impression compound, should flow at mouth temperature, that is 37 degrees centigrade. The flow should be less than 6% at mouth temperature. Whereas at 45 degrees centigrade, it should flow more than 85%. And these are used for primary impression of edentulous patients, peripheral seal materials, and impression of single crown for copper band impression. Whereas type 2 tray compound, at mouth temperature, they should flow less than 2%, whereas again 45 degrees, they should be around 70 to 85% of the flow should be there. Primarily, they are used for as a tray material. They are sufficiently rigid to support other impression materials. So they are supplied in the form of cakes, cones, sticks, and cylinders. And they are also available in different colors, like the brown color. They have higher working temperature, like 55 to 56 degrees centigrade. They are used for extending short borders of the custom prints. There are green types, which have a lowest working temperature, that is around 50 to 51, and they are most popular because they have easy flow and good handling properties. There are gray compounds. They have average working temperature and they have longer period of flow compared to the green. And there is white and black, which are high fusing, mainly used in the cake forms. Now coming to the fusion temperature, which is at 43.5 degrees centigrade. Its practical significance is that it indicates a definite reduction in plasticity of the material during cooling. That means from a higher temperature, if you come down, you cool it, so at 43.5, you will see a definite reduction in the plasticity. The softness will reduce. Above this temperature, it will remain plastic. Thermal conductivity is low of this material. So while softening, you have to break it into pieces and then soften it. Then thermal contraction, there is linear contraction of about 0.3 to 0.4% only. When you remove it, bring it from the mouth to the room temperature. Glass transition temperature is 39 degrees. It is the temperature at which there is an abrupt increase in thermal expansion coefficient, indicating increased mobility is called as glass transition temperature, which is characterized by a glassy structure. So at this temperature, basically the particles, the molecules, they start to become mobile and they break down and their bonds are broken down basically and they start to change this state from one state to the other. So below this temperature, it loses its fluid characteristic and has a significant resistance to shear deformation. Dimensional stability. So it's ensured by carefully preparing and handling the material. Therefore, avoid over or prolonged heating. This is very important. We should avoid overheating or prolonged heating. Adequate flow to allow close adaptation to the tissues and minimum of internal stresses in the impression. So this is very important, this point. We have to, there should be less internal stresses which are developed. We have to minimize that. Now, so that the flow should be adequate. When you are making an impression with it, make sure that the flow is good. That means you have heated nicely, kneaded it nicely. Now, the tray or the copper tray or the container, whichever which you are going to use it as a tray, must be rigid and it should be stable. So the impression should be withdrawn after the complete hardening. That means after when you place it in the mouth, at that time it will be plastic. So when it comes down, the temperature comes down to room temperature. I mean, the temperature of the compound comes down to the mouth temperature. At that time, it will harden. And after, you should ensure that it completely hardens, then you remove it. Otherwise, distortion will occur. Cast or die made immediately to avoid inaccuracies caused by the reverse stresses. So we advise that immediately when you remove from the mouth, you wash it and you disinfect it and you pour the impression to make the cast. Causes of internal stresses. What can be the causes? Like number one, the high coefficient of thermal expansion. There is a relative temperature difference drop from the mouth to the room temperature. Now, there can also be poor thermal conductivity due to poor thermal conductivity and relatively large temperature drop from the temperature. Now, manipulation, treating, it is treated in thermostatically controlled water bath at 55 to 60 degrees centigrade. That means that is the water, that is the temperature of the water bath. Okay. Now, the compound should be broken into, I told you, broken into small pieces because of their poor thermal conductivity. It must be immersed in a water bath for sufficient time to ensure complete softening. However, if it is left too long, some of the constituents may wash out like stearic acids. They will come out and they will perturb the properties. Wet kneading, if you knead it inside the water, it will be incorporated and it will act as a plasticizers. So there will be the kneading, and by kneading for 1 to 3 minutes, the flow of the compound may be more than the dough. So try to knead it outside the water. Construction of the cast after that, gypsum product is used and it is used to pour the impression and within 1 hour. Disinfection, remove the debris, saliva, rinse it first, then you can place it in butyl aldehyde or iodophore for 10 to 30 minutes. Advantage of this material, they are rigid when they are set, they are inexpensive, they are non-toxic. But disadvantages are that due to pressure, while making the impression, the tissues will be compressed. That means we record it in a compressed state, mucocompressive tissues. Distorts easily, leading to poor dimensional stability, cannot be removed from the undercuts, and high thermal expansion does not reproduce fine surface detail. Coming to the second impression material, that is the zinc oxide enamel impression paste. It is rigid and irreversible. Composition, it consists of 2 tube pastes. That is, number one paste is the first tube is the paste, which contains zinc oxide of 80 to 87%, and vegetable or mineral oils, which acts as a plasticizer, and they also mask the action of eugenol, the irritating action of eugenol. They will mask it. The second tube is the catalyst tube. It contains eugenol, oil of clove, gum polymerized rosin, fillers, resinous balsam, accelerators. All these are added. Classification. According to this specification number 16, they can be classified into hard set, type 1, type 2, soft set. Depending on ethanol content also, they can be ethanol containing or non-containing phases. Second reaction, it is a chelation reaction. There is an acid-base reaction to form a chelate, and the product is known as zinc ethanol rich. Chelate compound. The zinc atom held by two ethanol chlores due to the ionic salt bonds formed between the zinc and the phenolic oxygen of each molecule of the ethanol. It is also known as the autocatalytic reaction. Why autocatalytic? Because the water is needed to initiate the reaction as well as it is a byproduct. As you can see here, look in the first line, zinc oxide plus water will give you zinc hydroxide. In the second line, zinc hydroxide plus the acid will give you zinc eugenol plus water. So this water which is released, it goes back to the first reaction and initiates the reaction, keeps on reacting. This reaction keeps on going, so it's like an autocatalytic. Setting time, initial setting time, it is a period from the mixing, beginning of the mixing till the material ceases to pull away or spring out when its surface is touched with a metal rod or specified dimension. Impression should be seated in the mouth before the initial set. This is very important. It should be seated in the mouth before the initial set. So you have to do a little hurry. You have to mix it quickly and ensure that it is still in a less viscous state. It has not reached the initial filling time, and you have to load it in the tray and make the impression. Place in the mouth. Then the final setting time, rod fails to penetrate the surface of the specimen more than 0.2 mm under the load of 50 grams. So basically, there are setting times for type 1 and type 2. Type 1 is 3 to 6 is the initial, which is same for type 1 and type 2. Final setting time 10 minutes for type 1 and type 2 is 15 minutes. We normally use type 2. So control of the setting time. How can we control the setting time? If you want to decrease the setting time, you can add zinc acetate or other accelerators. It will quicken this, fasten the setting rate. Or we can also add a small drop of water while manipulation. How can we increase the setting time? We can do that by cooling the spatula or the mixing slab, or we can also add some petroleum jelly, mineral oil, olive oil. Okay. By changing the ratio of zinc oxide ethanol paste or ethanol paste, retardation or acceleration can also be occur. That means we can use either we can reduce the catalyst paste, or we can adjust it also. Now the properties, consistency and flow should be homogeneous and flow uniformly against the tissues while the impression is being obtained. Thick consistency will compress the tissue. Thin consistency will relax. It will record the tissues in a relaxed condition, what is known as the microscopic condition. Rigidity and the strength, it should be unyielding when it is removed from the mouth and should resist fracture. Dimensions, it is a very good material. Dimension, it is very stable. It only shrinks 0.1% or even less than that at the end of 30 minutes after mixing. Can be preserved indefinitely without changing shape due to relaxation, water running away probably. So we can use this material after making impression. We can pour it even after. I mean, you don't have to pour it immediately. What with a thick base plate tray on standing may result in distortion of bread. Manipulation. Mixing is done on either on oil impervious paper or a glass mixing slab with a stiff stainless steel spatula. The proper proportion is obtained by squeezing the rope at same length from each of the tubes. The orifices of the tubes are regulators to deliver the proper amount for each of the tubes. Now, two ropes are mixed with the first swipe of the spatula, and they are mixed in a circular motion and for 1 minute until a homogeneous color is obtained, which is speed free. That means it should be homogeneous. None of the constituent components should be visible. Now, impression making. Now, mix is spread in a thin layer over the tissue bearing surface of the custom tray and carried to the mill. Should be held firmly in position until it is thoroughly hardened. The accelerating action of the heat of the mouth and saliva on the surface of the tooth causes adjacent surface of the impression to harden first. Disturbance of the impression at this stage will result in vortex. Therefore, we're trying to say that when you take it in the mouth, keep it there for the required amount of time for the final set, let's say 10 to 15 minutes. And after that, you should ensure that yes, it is set properly. Then only you can put your nails or you can put any sharp object and see if the indentation is there or not. And then after that, you should only remove it. Now, in some cases, when there is stinging or burning sensation, these are the disadvantage of zinc oxide on taste. Like the burning sensation, some people cannot withstand the burning sensation, and free ethanol present may also leach out, and it will cause disagreeable taste, and also chronic gastric disturbances may occur where when the surgical tax is kept for several weeks. So these are the zinc oxide. In these kind of cases, we will use non-enamel impression case. And then a material similar to zinc oxide enamel reaction methods product can be formed by saponification reaction producing insoluble soap. So in this case, zinc oxide is reacted with carboxylic acid and orthoxide water. Okay? This disadvantage of this is again it is a disagreeable order taste. Advantage: relatively rigid material, thus impression can be removed from the mouth without any deformation. Allows sufficient working time. Registers surface details accurately. They are dimensionally stable. Minor defects can be corrected locally, but adding a fresh mix to the area and carefully revisiting the impression in the mouth. But there are certain disadvantages as well. It requires a special care. It's sticky in nature and adheres to the tissue. Cleaning is difficult. Presence of eugenol causes tissue irritation and burning sensation. Some patients are allergic to eugenol, so cannot be used for making impression of the teeth and in the cut area as it is inelastic in nature. Coming to the next impression, impression plaster. This is type 1 impression plaster, gypsum product. So they are basically rigid, irreversible, and they are microstatic. So the composition is similar to type 2, that is dental plaster. That is now it consists of calcined beta calcium sulfate hemihydrate. When it is mixed with water, it forms calcium sulfate dihydrate. It also contains potassium sulfate, which acts as an anti-expansion agent and an accelerator. Borax is added to retard as a retardant. Pigment such as alizarin red makes a clear distinction between the impression and a model. Natural gum like tragacan gives cohesion to the mouth and facilitates bottom molding of the impressions. PE solution, that is known as anti-expansion solution, it consists of potassium sulfate 4%, borax 0.4 to 1%, and alizarin red 0.04%. Soluble impression plaster, it is also known as soluble impression plaster because it contains potassium starch, is incorporated, and it will disintegrate due to swelling of the starch and makes it soluble. So after the cast is hardened, the impression and the cast are immersed in hot water, thus facilitating a rapid removal of the impression from the cast model. Added advantage of the cast, there is more to that. Starch also produces smooth mix, produces slightly sticky mix that adheres to the tray even when it is in thin layer, serves as an inert filler and reduces the temperature rise. Now, the setting time and the setting expansion, water water ratio, higher the ratio, slower is the setting and lower is the expansion. Saturation time, longer the mix, lesser the setting time and greater will be the expansion. Temperature increased temperature faster the setting, hence it will set more quickly in the mouth than in the bowl. Properties, main difference between impression plaster and model plaster, more rapid setting in the impression plaster is in order to avoid discomfort to both patient and dentist. This is very important. We should, because otherwise, if it is a long, then patient will be in discomfort. Smaller setting expansion for greater accuracy in impression plaster. This is very important for an impression material. We don't want higher expansion. Now, much lower strength so that fracture can occur easily if material engages with angle. Accuracy. Very accurate impression due to initial fluidity of the material. Um, it allows to record the soft tissues in an incompressed state because it is microscopic. Absorption of the moisture from the surface of the oral surface tissues, facilitating intimate contact between the impression material and the tissue. That means you can say that they are like hydrophilic compound. They're loving, water loving. So the tissues, even if they are wet, they will have intimate contact with the tissue. Minimal dimension change on surface. Now, manipulation, water powder shows 0.06, that is 100 gram of powder and 60 ml of water. Mixing is done in rubber bowl using a stiff level spatula to get fluid mix. Mixing time 30 to 45 seconds. Impression making in a custom tray with 1 to 1.5 mm of spacer is required. The wash raster impression in primary compound impression is used. Recording of the impression of the undercut area in fractured pieces, which is then secured in a correct position by sticky wax or sandpaper. So while you're moving from the edentulous mouth, even if there's an undercut, it might fracture. So even if it fractures, you can secure it nicely together and stick it with a sticky wax. Construction of the cast, then the mix of the model plaster or the dental stone is then poured directly into the type 1 impression plaster. Then after that, water and the dissolved hemi-nitrates will penetrate into the porous plaster of impression, and then the set cast will be tightly bonded to the impression. A separating medium facilitates easy separation of the impression from the cast. So the type of separating mediums are, number one, produces thin film over the impression material, impression plaster, resulting in some loss of surface detail and accuracy. Example of them are varnish like sandware, Cynodent and eminent solutions. And there are other types as well, which reacts with the surface of the plaster itself, making it impervious with very little loss of surface detail. Example like soap solution or water glass solution, which can also be recommended. Advantages: dimensionally accurate with good surface detail, absorbs particle technicians during settings, speedy handling and easy manipulation, produces minimal tissue displacement. But there are certain disadvantages that cannot be used for compressed tissues. In very wet mouth, surface of the plaster tends to be washed away, spoiling the surface of the tissue. They are exothermic, and after setting reaction, they are exothermic, so heat is liberated. Separating media used may obliterate the details. So not be removed from the undercut without hope. Coming to the impression waxes, they are thermoplastic, rigid and reversible. Composition mixture of low melting paraffin wax and these wax in the ratio of 3:1. Examples are Iowa wax, character wax, and the types you can say there is corrective wax, there is white registration wax. The characteristic and uses of character wax, that is also known as fluid wax series. There are 4 types. Number 1 wax, the properties is that they congeals rapidly with slight amount of shrinkage, tissue pink in color, hard with practically no flow at the body temperature, and they are quite brittle. The uses, they support the extension of the impression wax when there is need to carry it beyond the border of the temple, base. Final wax up of porcelain or resin teeth after they have been adjusted to the desired position. Reposition, extension, partial denture before making rebase impression. They act as a support to maintain the correct position of the base and prevent its rotation. Coming to number two wax, they're yellow in color, has slight fluid body temperature, ability to adapt very slowly to the ridge structure makes it useful as a temporary lining of a base, which should be worn for a short time. In coming to type number 3 wax, they are red in color. The flow is greater than type 2, but less than that of the impression wax. Used for correct, used to correct the minor discrepancies, such as the areas of an inaccurately fitted base before placing the impression. Number 4 type of wax, orange in color. They have high rate of body temperature, must always be carried by a temporary base when it is recording the supporting contour of the subdistal structure. They used for making a correctable impression. Now, corrective impression wax, they are used as a wax veneer over an original impression to register the details of the soft tissue. That means we already made an impression. Over that, we are using this corrective impression wax to as a veneer to achieve better details of the soft tissues. They record the mucous membrane and underlying tissues in functional state, and their flow is 100% at 37 degrees. So this is also a disadvantage because during removal there are chances of distortion. Coming to the bite registration work, they are used to articulate accurately certain models of the opposing quadrants. Their flow can be 2.5 to 22% at mouth temperature, but again the same disadvantage that they are distortion while removing. Manipulation in use. You can apply them with a soft and bristle brushes in small quantities to fill the areas of impression with insufficient material. The surface of the tray is covered with first with a continuous layer to prevent moisture from getting under the wax. To loosen it, surplus of the impression, number 4, is added inside the bottles. Then the tray is tilted to prevent the wax from running towards the center. Achievement of relationship of the impression is determined by the glossy appearance. So there should be a glossy appearance. Only then we can feel that yes, we have achieved a relationship. Disadvantages: the easy deformation in the stress, minimum surface hardness, poor dimension stability, more time consuming, extremely skill is required to prevent this problem. Coming to other impression materials, they are known as hydrochlorides. Under the hydrochloride, there is reversible and irreversible. We'll be talking about the reversible hydrochlorides first. As the name suggests, they are reversible. They can be used again and again. And they are elastic and they are mucous-like. Ingredient consists of agar-agar in the tray form, which is 12 to 17% by weight and 6 to 8% by weight in the syringe. Potassium sulfate, they are plaster hardness. Borax, again, it improves the gel strength by intermolecular fraction. Isotropic material, they have the thickness. Fillers are there. Water is present in 85% and coloring elements. Properties: viscosity of sole, that is, they are viscoelastic material. Viscosity that is contained in the tray and reproduces these details of the teeth and soft tissue. Gelation temperature: after 8 minutes of boiling, they should be fluid enough to be excluded from the container. After tempering, the solution should be homogeneous and set to gel. They should set to the gel form between 37 to 45 degrees. Strength: there is time dependent. greater at higher rate of loading. Impression to be removed with a snap. This is why they always say that alginate and agar-agar, whenever you remove it after setting, it should be removed in a snap. Otherwise, there can be permanent deformation in it. They are related to the brush heap structure. That means the more the concentration of agar-agar, there will be more density, so strength will be more. Inversely related to temperature. That means if there is higher temperature, then it's going to be it will be more solve will be more there. Okay, solution. It will be in a solution form. So and the higher is there, that means the strength will be less. Compressor strength is around 8,000 grams per centimeter square, where the tear strength is only 700 grams. If you store it under air, there is chances of shrinkage is there because of the evaporation of water from the gel. And if you store it under water condition, there is chances of expansion due to imbibition and absorption of the water. And under 100% relative humidity, there can be shrinkage due to syneresis. And also in inorganic salt solutions, there can also be expansion or shrinkage depending on the electrolyte which is present. Storage media, 2% potassium sulfate and 100% relative humidity. But we advise that we should pour the impression as soon as possible. Flexibility, 4 to 15% of flexibility under 14.25 stress. Permanent deformation of 1%. Material is adequately gelled, removed with a sharp thrust, and minimum undercut is in the prepared cavity. Compatibility with gypsum, it is more compatible than alginate. They are stored in humidor. First, you have to rinse to remove the exudate from the which are formed due to syneresis. Manipulation, they are prepared in a conditioning unit. If you want to reverse it from gel to stone, you have to boil it first for 8 to 10 minutes. And in high altitude areas, you require to add propylene glycol. And every re-liquefying, you have to additionally add 2 to 4 minutes to break the brush heap structure. Now, after that, the first compartment you have added the boiling liquefying compartment. The second compartment is known as the storage compartment, which contains the temperature should be 60 to 66. You can store it for hours. And then tempering is the third compartment, is known as the tempering compartment. Over there, you have to load, and the loaded tray is placed in the tempering compartment, which has a temperature of 45 degrees centigrade water. For 3 to 10 minutes, you're going to place it. The purpose of this is to increase the viscosity and cool the temperature to the oral, so that the oral temperature can be compatible. Now, impression procedure, you need a water-cooled impression phase. The temperature of the circulating water should be 18 to 21% degrees centigrade, and is circulated for 3 to 5 minutes. The syringe material is ejected on the prepared heat, whereas the tray material, which is water soaked, outer layer soaked with dry gauze sponge, is removed, and then it is seated in a passive pressure. And then remove the tray with a jerk rather than teasing it out. Again, we are saying this, you have to remove it in a snap so that there is no permanent deformation. And this is there is a wet field technique. You can get this as a short note. The impression in this tooth surface and the tissues are first, they are flooded with warm water. After that, syringe material is placed over the incisal and the occlusal surfaces of the teeth, and then the tray material is seated over the syringe material while it is still in the liquid form. The hydraulic pressure of the tray material forces the fluid syringe material down to the areas to be restored. Construction of the cast, after that, you can the hardening solution is 2% potassium sulfate, potash alum or zinc sulfate. They're added. They act as the accelerator for the gypsum and reacts with also the gel and prevents syneresis. After it is poured in stone, place it in the humidor or 2% potassium sulfate. should be kept in contact with impression for 30 to 60 minutes. After 60 minutes, we should remove it. Impression disinfection, hydrophobic bleach or glutaraldehyde can be used. Water to be changed between patients in the tempering compartment. Tray to be packed in plastic prior to trying in the mouth. Now coming to irreversible hydrocolloids. They are elastic, lipostatic, and irreversible. Constituents consist of soluble salts of arsenic acids, calcium sulfate, sodium phosphate, glycols, fillers, other salts, flavoring agents, pigments, all these are there. Chemistry, the relation is that from calcium sulfate, we get the calcium ions. They react with the retardant, that is the sodium phosphate. It forms the calcium phosphate plus sodium ion. Once the sodium phosphate are used up, then finally the potassium alginate reacts with calcium sulfate, which is the reactor, to form the calcium alginate. And this two layer of the retarder gives us time for manipulation. Then the gel structure, that is the brush heat structure, calcium alginate precipitates as a fibrous network with water in the intervening capillary spaces. Fibrils are held together by primary bonds. The calcium ions replaces the sodium ions and thereby cross-linking between the alginate molecules occur to form a polymer network. The types, there are two types. Type 1 is fast set, type 2 is regular set. In the mixing time for type 1 is 45 seconds, type 2 is 60 seconds, working time 1.252, and whereas 3 minutes is for type 2. Uses, type 1 is normally used in children or problematic patients which cannot open their mouth for a longer time, whereas type 2 are normally used in a regular setup. Properties, strength. They are time dependent, rated at higher rate of loading, that is impression to be removed with a snap. So if you remove it in a snap, the strength will be better. Compressive strength is 5,000 to 9,000 and tear strength is very poor, that is 380 to 700 grams per centimeter square. Factors affecting the strength is water powder ratio, mixing time, and composition. Flexibility is 11 to 15%, hard sets by 3 to 8%, lower water to powder ratio will give you lower flexibility. Therefore, permanent deformation is 1.2%. It is reduced by bulk of the material. Therefore, we should use a stock trays which has approximately 5 mm between the tray and the tissues. The space should be there. And the viscosity, the low viscosity will give a microstatic pressure period. Dimensional stability in air, again it loses water and it will shrink by the process of syneresis. In water, if you keep it under water, it will absorb water by the process of imbibition and it will swell up. Again, you have to store it in 100% relative humidity for an hour. But again, it is advised to pour it immediately. Shelf life deteriorates with elevated temperatures. Manipulation, you can manipulate that in a 38 ml of water for 16 grams of powder. A measured amount of powder is shifted into a pre-measured amount of water that is present in a clean rubber ball. Mixing is done with a curved metal or a plastic spatula with vigorous figure of 8 motion and swiping or stroking against the sides of the rubber ball with intermittent rotation. That is 180 degrees of spatula to press out the air bubbles to achieve a smooth, creamy mixture that does not readily drip off the spatula when it is raised from the bowl. And the mixing time will be around 1 minute. Setting time for fast is 1.5 to 3 and normal set is for 3 to 4.5 minutes. And the trays which are preferred is the perforated tray or the rim lock trays for mechanical intervention. Disinfection. Chlorine compounds like household bleach, you can use 1:10 dilution, iodophores or synthetic phenols. Impressions is rinsed thoroughly. The disinfectants can be sprayed and then wrapped immediately into a disinfectant soaked paper towel and placed it in a sealed plastic bag for 10 minutes. Development of alginate impregnated with antimicrobial compounds, also known as self-sterilizing impression materials. That means we are adding certain compounds in the alginate which will make them antimicrobial actions, like 0.2% chlorhexidine we can add. We can add didecyl methyl ammonium chlorides, 15% povidone, iodine, and silver nanoparticles. Laminate technique. Another short note you can have agar-alginate combination impression technique. That means there is a combination of agar and alginate. In the syringe agar, we will use the syringe agar first, injected over the preparation in the coronal areas, and then this chilled alginate mix, which is placed in the tray, they are seated over the top of the agar. So in this case, the advantage is more accurate surface reproduction by the agar. Agar are more compatible with gypsum and elimination of water-cooled impression film. There is no need of the water-cooled impression film. In these cases, developments. Dustless alginates are made. That means they are coated with glycol so that they reduce the dust which comes out normally. The fluffing, after fluffing it normally used to come out and we have to inhale it. And there was chances of silicosis. So there are other alginates like chromatic alginates. They contain chemical indicators that indicates the stages of setting, which is based on the pH, change in the pH. Siliconized alginates are there, which are hybrids of alginate and silicon elastomers, properties which are close to alginates. They are two-phase system, fine surface details, and better pH strength. Then there is modified alginates. Modification 1 is that the alginates are supplied as a sole form containing water, but it doesn't contain the calcium ion. And another, the reactors which are is present as plaster of Paris is added at the time of manipulation. Another modification they have done is two-component system in two-phase system. There is one paste contains the alginate salt, the other paste contains the calcium reactor. Coming to the non-aqueous elastomeric impression material. These are elastic and they are irreversible. Definition: a compound of flexible chemical polymers which are either chemically or physically cross-linked. They are easily stretched and rapidly recover their original dimension when the applied stress is released. They can be classified into three. There is mercaptan, silicon, and polyethers. The mercaptans are lead oxide catalyst and the clear catalyst. Silicons are of condensation and addition silicon. They can also be classified according to viscosity, very high viscosity, heavy viscosity, medium body, light body. Very heavy viscosity also known as putty. Chemistry and composition. Polysulfides, the trade names are permelastic, lead dioxide system, Soflex, Omniflex. Composition: the base paste consists of polysulfide polymers 80 to 85%, fillers 44%, plasticizers, sulfurs. Catalyst paste: lead dioxide, dibutyl phthalates, sulfurs. Chemistry: oxidizing agents, that is lead dioxide, initiates the polymerization. First, the chain lengthening between the terminal SH groups occurs, which increases the viscosity. Subsequently, cross-linking between dependent SH groups occurs, and they give rise to the elasticity. Polymerization reaction, byproducts is water in this case, and it is an exothermic reaction. There is 3 to 4 degrees of rise in temperature. So you can see the mercaptan with the lead dioxide will give you polysulfide rubber. Lead oxide plus water is liberated. Now coming to second type of that is the condensation silicon. Trade name is Sil2 Voltex. Composition is based on catalyst phase. Under the base phase is the liquid silicon prepolymers, fillers, and catalyst is tetraethyl silicates and stannous octoate. So in the chemistry, when they react, hydroxy terminated dimethyl siloxane and tetraethyl orthosilicate in the presence of stannous octoate, there is the catalyst. Silicon rubber will be formed with the liberation of ethyl alcohol that evaporates and leads to contraction. So it is not dimensionally stable. Third type is addition silicon, which is mostly used. Trade name Reprosil, Provil, and President. The composition, there can be base and catalyst form. Base is polymethyl hydrogen siloxane, other siloxane polymers, fillers, and catalyst, divinyl siloxane, platinum salts, which act as a catalyst. Palladiums are added. They act as a hydrogen absorbers, platinum, retarders, and fillers. So the chemistry, when they react together, vinyl siloxane plus silane siloxane in the presence of catalyst will give you silicon rubber. But and there is no byproduct if we if there is no impurity with the resin. That means if you have added it, manipulated in the correct proportion, there will be no byproduct. But if the proportion is not improper or impurities might be there, so there is chances of hydrogen gas which is liberated, which can cause pinpoint voids in the stone cast when you pour them. So it is advised to pour them after half an hour or to 1 hour. Now, latex gloves contain sulfur, which also inhibits polymerization. So it is advised to use vinyl gloves or polyethylene gloves. Polyether is the fourth type of elastomers. Trade name is Impregam, Ramitex, composition base catalyst, polyether polymer, glycolether or phthalates, which are acting as plasticizers. There is fillers. Catalyst contains aromatics, sulfonic esters, cross-linking agents, colloidal silicas, and again plasticizers. So when they react, polyether plus sulfonic esters will give you cross-linked rubbers. The reaction is brought about by azurine rings, and the main chain polymers are ethylene oxide and tetrahydrofuranate. Coming to their properties, working time and setting time. So the polysulfides have the greatest working setting times, followed by silicons, then the polyethers. So if you want to increase the working time, we can chill the material or the mixing slab, glass slab. Altering the base catalyst will also alter the working time, but they are not advisable. So it's better to cool the glass slab. Condensation silicon, they will polymerize. They continue to polymerize for more than 2 weeks after the mix. Whereas addition silicon, there is little residual polymerization after material is clinically set. Dimensionally stability. The sources of dimensional changes occurs. There are 5 types of sources. First is polymerization shrinkage. Second, when there is a loss of byproduct, like in cases of polysulfide, there is water liberated. Condensation silicon, there is ethyl alcohol, which comes out. So in these cases, there is going to be dimensional shrinkage. Thermal contraction, when you remove it from mouth to room temperature. Imbibition of it can, when you expose it to any type of disinfectant, high humidity area, all that can lead to some dimensional changes, or also incomplete recovery of the deformation from the mouth. When either you have removed it before it is setting polymerization. So order of dimensional stability, addition silicon is considered the most dimensionally stable, polyether followed by polysulfide, then condensation silicon is the least. For maximum accuracy, condensation silicon and polysulfide should be poured immediately or within 30 seconds. Addition silicon, if it produces hydrogen gas, then it should be poured after 1 to 2 hours. Whereas polyether impressions, if they are stored in water, slowly they will absorb water and change the dimensions. Strain, the order of stiffness. Polyether has the greatest stiffness, followed by addition silicon, then condensation polysulfide. And again, according to viscosity, putty will have the greatest stiffness, then heavy, medium, light body. But newer polyethers in medium viscosity are more flexible than hydrophilic addition silicon. So that means newer polyethers, they have come which are quite soft and they can be used. Hardness increases from low to high consistency. Now, let's say polysulfides and low, medium, high viscosity addition silicons, there is no significant change in hardness with time. Okay, so even if you can you place them at And immediately you can pour them after even 1 week, they will have the same hardness. Condensation silicon and addition silicon putty and polyethers. They will their hardness will increase with time. Now, low flexibility and high hardness. There will be more space for impression material between the tray and the teeth, which is required. Therefore, example like polyether requires a 4 mm of space between the teeth and the tray. Tear strength, or the order of tear strength, is polysulfide is the greatest, has the greatest tear strength, and polyether, silicon, and hydrochlorides are the least tear strength. So factors which are affecting the tear strength is the increase in the consistency. If there's more consistency, then that means increased tear strength. Addition of a thinner will decrease the tear strength. Rapid rate of removal from the mouth increase the tear strength. Detailed reproduction. Silicons and polyethers, they register details better than polysulfide. Except for very high viscosity products, they all should reproduce a V-shaped groove and a 0.02 mm wide line in the water. That means there should be this much of accuracy should be there. It should be compatible with gypsum products, which is very important. Wettability is the measurement of the advancing angle of the water. Wettability is directly proportional to the ease of pouring the stone models. If it is more wettable material, that means it will be easier to pour the with the gypsum powder. So hydrophilic material, that means the hydrophilic addition silicons and polyethers, they are the best wettable materials. Whereas hydrophobic materials like polysulfide containing silicon or the conventional addition silicon, they are the least wettable. So mode of increasing the wettability, we can add surfactants while before making impression or before pouring the cast. Shelf life, polysulfides and polyethers have a greater shelf life than the silicons of 2 years approximately. Should be stored in tightly closed containers like tubes and cool environment. Biological properties, polysulfides, they had toxic effects of lead, which is again a question of use of lead compound. Polysulfide results in the lowest cell death counts. Condensation silicons, they are non-toxic, but direct skin contact with the accelerator may cause allergic reaction. Whereas addition silicons, they cause less tissue reaction than the condensation silicon. Polyethers, the aromatic sulfonic acid esters can cause contact dermatitis, which is a hypersensitivity type of reaction. They show the highest cytotoxicity scores. That means they are cytotoxic. No cytotoxic effect on exposure to polyether with imine catalyst. So that's why imine catalyst are there. Now there's common errors induced by compatibility problems. The segment of the impression material lodged in a sulcus will lead to tissue inflammation, which might be misdiagnosed as caused by a tooth preparation or cementation. So therefore, the visual inspection of the impression after removing from the mouth is very, very important. We should always see if there is any tissue, any impression material which is fractured, broken from the tray, and it is placed inside the mouth between the tissues or in the sulcus, it should be removed immediately. In these cases, polysulfide has the advantage of as they have greater tear resistance and they are also radio opaque, so they can see them in the X-ray. Now, advantages. They have excellent surface detail, dimension accurate and stable, requires undercuts, polysulfide, they have good tear resistance, addition silicon, they have excellent dimension stability, even in cold sterilizing solutions. Different viscosities are available for different situations. Pleasant feel is there in the mouth. They can be electroformed to give a metal dye. They are easy to manipulate. They do not affect hardness of the surface of the stone. But there are certain disadvantages like they are hydrophobic. Therefore, that means they slip on the wet mucus covered mucosa. For long setting time, like an example of polysulfide, 8 to 12 minutes, tear strength of the silicons are low, condensation silicons are dimensionally unstable. Polysulfide, they have a strong order and messy to work with. Complete adhesion to a custom tray is also required. Coming to recent developments, modifications in addition silicons, they have added palladium, which acts as a hydrogen absorber. So the advantage is that impressions can be poured immediately. There are fast setting addition silicons, the aquasil ultra fast sets, hydrophilized addition silicons. They can reduce the contact angle with water, improve the wettability, like by adding intrinsic surfactants inside the addition silicons, like nonyl phenoxyethanol homolog. Now, modification in polyethers, they have made them softer, like example pentasoft, impregum soft, they're less rigid for easier removal from the model. Fast setting polyethers, impregum quick set, pentasoft quick set. Visible light cured impression materials are there. Composition is polyurethane dimethacrylate resins. Silicon dioxide fillers are there, and polymerization is done at 480 nanometer of light source. Automatic mixing devices have come. That is, the features are their light and medium body with materials can be used with them. Mixing tip vary in diameter, length, and size of the tip opening. They're used for addition silicons can be used. Some polyethers and condensation silicons can also be mixed in this manner. Advantages, they have a greater uniformity in the proportioning and mixing. Fewer bubbles, air bubbles is incorporated and reduces the mixing time. There is dynamic mixing mixture for use for polyethers and addition silicon. The catalyst and the base are supplied in the plastic bags or in cartridges form. And the plastic mixing tip has internal spirals that are motor driven and they will rotate. So it is quite easy, as you can see. You just have to press the button and the machine will do the mixing for you and will come out from the tip. Advantage, easy to use, speed of thoroughness of the mixing. High viscosity materials can also be mixed with ease. But the disadvantage is the high cost and slightly more material retained in the mixing tip. Nowadays, digital impressions have come. So advantages of intraoral scanners are that the armamentarium which you use, like the impression trays, impression material, gypsum, all that has been eliminated. There is improved communication between the clinician and laboratory technician. That means the photos can be, images can be modified, recaptured, a soft copy can be stored, and it can be sent to the laboratory very fast, and cross infection, cross contamination is minimal. This is very good thing. But there are again the disadvantages are there because it requires expensive setup. The images of completely edentulous arches are less accurate. Presence of any type of blood and saliva obscures the subgingival finish. So developments are going on basically. And coming back to the manipulation. Now impression procedures. 5 steps are there: preparation of the material, preparation of the tray, making an impression, removing the impression, and then making the cast. So first, preparation of the material. So two-phase system. In the two-phase system, equal amount of base and catalyst is used, squeezed on the mixing pad, and then with the help of stainless steel mixing spatula, you mix it in a circular motion until a streak-free mix is obtained. Polyether. In the polyether, thinners can be added to reduce the viscosity. Putty form, there is addition silicon putty form. In that case, we have to use equal scoops of base and accelerator, and they are needed with fingers, either using vinyl or polyethylene gloves. Condensation silicons require number of scoops of the base, which is needed with a proportionate liquid or the phase system. Accelerator. Then after that, once you have done the manipulation, then preparing the tray. There is the stock tray, which is used with a very high consistency. There is the putty consistency. We use the stock tray or the custom tray, which has a 2 to 4 mm of spacer. The bulk should be evenly distributed, reduces quantity of the material, and dimensionally change is very less. Dimension change. So you have to select which tray you require, and then you can either have perforated trays, or if they are non-perforated, you can use tray adhesives, which bonds the impression material to the tray. For example, for polysulfide, butyl rubbers, and acrylonitriles in the organic solvents, they can be used for addition silicones. There are separate tray adhesives which are supplied, and they have polydimethyl siloxane and ethyl silicate as their constituent. They are available in two types. One is paint on, brush type, you can paint on it, or they are spray type of adhesives. They can be applied for 10 to 15 minutes before making the impression. Then after you have added the tray adhesive, you have applied, then after that, you make the impression basically. There is a multiple mix technique. In that custom tray, you load the heavy body material, and the syringe material you place it, the light body material is placed over the teeth in the first, and then the light body is placed in the prepared tooth, and the heavy body is placed over the custom tray, and you can see the photograph and how the light body is being added in the mouth, and then the tray material is on top of it, it is placed, and you get the final mix. That is called as multiple mix technique. Now there is a technique which is known as monophase, single viscosity technique. Monophase. That means you can use single material with a light body, and also it is placed in the tray as well as it is placed in the mouth. And then there at the same time you are using. That means we can see medium viscosity of the polyether and the adhesive silicone. They can be used. Only one mix is used. Part of that material is placed in the tray and part of it is placed in the syringe. And success depends on the pseudoplastic property of these two materials. So this is how to do it. And then there is a putty wash technique, or another name is reliant technique. It is a two-stage procedure. First, we use the putty material in the stock tray, and we make a primary impression. After that, it results in intraoral custom-made tray, which is formed by the putty. And then over that, the space for the light body is created. That is the wash material. Either by cutting away some of the tray putty or using a thin polyethylene sheet during the first primary impression. So any method you can use to create some space for the light body. And after that, you mix the light body and you place it in the putty impression and then seat it in the mouth again. So you can see it here, how the putty is being kneaded and placed over the tray. You make the primary first impression, then you can use a scalpel or any method to create space, and then you can place the light body in the mouth as well as in the impression, and then squeeze it. Then coming to squash technique, single step dual viscosity. That is single step. In this stock tray, we load the putty, and the syringe material is injected around the prepared tray, and then the tray is squashed over the syringe material. Therefore, the hydraulic pressure of the putty pushes the syringe material into the critical area. But the impression is made with the putty material and the syringe material setting simultaneously. But there is a disadvantage that the putty might displace the wash material. So there is a dual arch impression technique. Over here, we use triple trays. Patients are instructed to close their mouth in maximum intercustation position. That is the MIP. So they close it in their mouth. They close their teeth, okay, in MIP, and the tray out of the mouth. First, we have to instruct them and practice them. Then, dual arch impression procedure is made. That is, you place the loaded tray in position and instruct the patient to again close in MIP. So first of all, you have to load the tray in both sides of the tray. You can see the photograph here. This is a sectional tray. This is a triple tray. It is a thin sheet is there in between. So you have to load the impression in both sides, in the top as well as the bottom side of it. And you have to also inject it in the prepared tooth area and ask the patient to close in MIP position. And so that you get the dual impression, even in the maxillary teeth as well as in the mandibular teeth, you will get it simultaneously. You can also use dual arch multiple mix technique, that is the light body is in the mouth in the prepared tooth, and like a medium viscosity in the triple thread. Coming to the disinfection methods, condensation silicone, adhesive silicone, polysulfides can be disinfected with 2% glutaraldehyde for 10 minutes. Whereas polyethers, you can use chlorine compounds or iodophores, phenols. Long immersion, more than 10 minutes, will lead to dimensional changes. So the disinfectant should be sprayed on these impressions until saturated, and then wrapped in a disinfectant soaked paper towel and you can place it in a sealed plastic bag for 10 minutes. After removal of the plastic towel, then the impression should be rinsed, dried, and poured immediately with gypsum. Now, effects of mishandling. What are the effects that you can have for mishandlings? They can be rough or uneven surface on the impression. That can be lead to incomplete polymerization, that is premature removal of the mouth. You have removed it before even it sets. That can be cause of roughness, improper ratio of or the mixing of the constituents. You have not mixed them in the proper ratio. For adhesive silicone, agents that contaminate the material and inhibit polymerization. That means, like if you use normal latex gloves, that might inhibit the polymerization. Now, coming to another type of this defect is the bubbles that might occur due to too rapid polymerization, preventing the flow or air incorporated during mixing. Irregular shaped voids are also there, moisture or a debris on the surface of the tooth, or rough, chalky, or stone cast might occur. That is due to inadequate cleaning of the impression, excess water which is left on the surface of the impression, excess wetting agent might be left on the surface of the impression, premature removal of the cast, improper manipulation of the stone. All these reasons can occur. Distortion can occur due to lack of mechanical retention, adhesion between the trays and the impression materials, development of elastic properties in the material before the tray is seated. That means you might have reached up to the setting time before the tray is seated, movement of the tray during polymerization, and premature removal from the mouth, delayed pouring in case of polysulfide or condensation silicones, that might lead to distortion. Now, the application of the impression materials, they can be used for making impression of prepared teeth, and when you have to fabricate fixed partial dentures. They can be used for impression of dentulous mouth for removable partial denture fabrications. They can be used for making impression of edentulous mouth for complete denture fabrication. Polyethers is also used for border molding of special trays. The impression materials can be used for maxillofacial impressions and in implant dentistry for making impressions, duplicating casts, bite registration, and so on. So many places you can use the impression material. So coming to the end over here, thank you for your attention. I would like to conclude that the most important thing that we require to know is that there are so many impression materials. You should know the details of the impression materials, which impression material is to be used in which condition, and what are the drawbacks, what are the advantages of each impression material, so that you will lead to a more accurate impression, and what are the trays which are used, okay, what are the techniques of making the impression, the manipulation techniques you should know. Okay, these are the things which you should practice, and once if you go through the books, the renowned books like Phillips, okay, uh, and Manipal is also there. All those books are there, so you can go through them. If you have any question, you can get back to me. Thank you so much.